Evergreen shrub, the family of Sapataceae, grown for its mild fruits that make subsequently eaten sour foods taste sweet. The miracle fruit plant is native to tropical West Africa, where it is used locally to sweeten palm wine and other beverages. The unrelated sweetbriar plant, Thaumaticocos danielii, is also known as miracle fruit for its similar ability to make sour foods taste sweet. The other name of miracle fruit is Becquerella dulcifica, Bumelia dulcifica, fruit miracle, fruit miraculeur, fruita milagrosa, miracle berry, miraculin, miraculous berry. Richadella dulcifica, Sideroxylon dulcificum, Syncephalum dulcificum. Miracle fruit is an evergreen shrub that grows in West Africa. The berry of the miracle fruit plant is used as medicine. People take miracle fruit to treat diabetes and correct chemotherapy-related taste disturbances. In foods, miracle fruit is used as a low-calorie sugar-free sweetener. Insufficient evidence to rate effectiveness for diabetes. More evidence is needed to rate the effectiveness of miracle fruit for these uses. Miracle fruit contains a chemical that affects taste receptors in the tongue. This chemical makes the tongue register sour tastes as sweet tastes. The chemical itself has no taste at all. There are some concerns about information available to know if miracle fruit is safe. Precautions and warnings for pregnancy and breastfeeding. Not enough is known about the use of miracle fruit during pregnancy and breastfeeding. Stay on the safe side and avoid use. Dosing considerations for miracle fruit. The appropriate dose of miracle fruit depends on several factors such as the user's age, health, and several other conditions. At this time there is not enough scientific information to determine an appropriate range of doses for miracle fruit. Keep in mind that natural products are not always necessarily safe and dosages can be important. Be sure to follow relevant directions on product labels and consult your pharmacist or physician or other healthcare professional before using. You need to know what vitamin E, it's a nutrient that helps protect your cells from harmful free radicals. It's a nutrient that helps protect your cells from harmful free radicals. Vitamin E also helps your body fight germs and keeps your blood vessels open and clear of clots. You may also hear it called a fat-soluble vitamin, which means it needs fat to dissolve in your body. Most people do get enough vitamin E in their diet for good health. Most people do get enough vitamin E in their diet for good health. If your levels are low, it's likely because it's harder for your body to absorb the vitamin or the fat it needs to process it. This may be due to genetic problems or diseases like Crohn's or cystic fibrosis. If you have a condition that hampers your vitamin E levels, your doctor would focus first on treating that underlying cause. If you do have an illness that keeps your vitamin E levels low, you might get sick more, and you might start to lose control or coordination of some body movements. This is called ataxia. Nerve damage could cause pain and weakness in your hands and feet called peripheral neuropathy, as well as vision problems retinopathy. Talk to a doctor if you notice any of these symptoms, which could have other causes. Here are the recommended amounts should you get. 0 to 6 months, 4 milligrams, mg, or 6 IU per day. 7 to 12 months, 5 milligrams or 7.5 IU means international unit. 1 to 3 years, 6 milligrams or 9 IU means international unit. 4 to 8 years, 7 milligrams or 10.4 IU means international unit. 9 to 13 years, 11 milligrams or 16.4 IU means international unit. 14 and up, 15 milligrams or 22.4 IU means international unit. Breastfeeding women, 19 milligrams or 28.4 IU means international unit. The good sources is sunflower, safflower, and wheat germ oils are top sources, followed by corn and soybean oils. Sunflower, safflower, and wheat germ oils are top sources, followed by corn and soybean oils. Asparagus, avocado, and nuts, especially almonds, are also good. And there are fortified foods that have vitamins including E added, such as breakfast cereal, fruit juice, and margarine. You probably don't need a vitamin E supplement, since it's so rare for someone to have health problems due to lack of vitamin E. You probably don't need a vitamin E supplement, since it's so rare for someone to have health problems due to lack of vitamin E+. It's almost always best to get your nutrients from food instead. Still, if you have certain conditions, a supplement could help. Just check with your doctor first. Because too much could cause serious problems, especially if you have some illnesses or take certain medications. You can't overdo vitamin E from the food you eat, but you can with supplements. Too much could make you bleed more after an injury and raise your risk of stroke, among other problems. That's why it's best to limit any supplements to no more than 1,500 IU/day for the natural form, and 1,100 IU/day for synthetic. Just 400 IU/day could raise your risk of prostate cancer or worsen the eye disease retinitis pigmentosa. Supplements can, taking them with anti-clotting drugs like warfarin makes you more likely to bleed. Cholesterol drugs called statins may not work as well with vitamin E if you also take selenium, vitamin C, and other antioxidants. It may even interfere with cancer treatments like chemotherapy and radiotherapy. Always tell your doctors about all the medicines and supplements you take before you add anything new. Vitamin E supplements don't seem to do much to protect against heart disease or cancer, though scientists continue to study that. The same seems true of brain diseases like Alzheimer's and neurological diseases like Parkinson's and ALS. In some people, high doses of vitamin E supplements appear to slow the progress of a condition called age-related macular degeneration that can cause blindness. Some premature babies who are born before full term may not have enough vitamin E often. The breast milk of preterm mothers is higher in this nutrient. But sometimes your baby might need more to stay healthy. Any supplements should be prescribed in exact amounts by your doctor because too much of the vitamin could be bad for your baby. The hepatitis C. Hepatitis C, HCV, means hepatitis C virus, is a virus that causes inflammation of the liver. It is a member of the family of viruses that includes hepatitis A and hepatitis B. These viruses behave differently and have different modes of transmission. Hepatitis C can cause serious liver damage, liver failure, liver cancer, and even death. Hepatitis C, in Africa, the World Health Organization estimates that 0.5% to 1% of the population is infected. Exactly how many cases of hepatitis C there are around the world is unknown, but the World Health Organization estimates that 0.5% to 1% of the population is infected, with prevalence higher in Europe and the Eastern Mediterranean. Hepatitis C is a bloodborne illness, meaning it is transmitted via contact with infected blood. Usually the virus enters the body through a puncture wound on the skin. The most common way hepatitis C is transmitted is via injection drug use. Sharing dirty needles with someone who is infected can transmit hepatitis C. Healthcare professionals may contract the virus via needle stick injury. Prior to 1992, the US blood supply was not screened the way it is today. So some people contracted hepatitis C from infected blood transfusions. Rarely, babies born to hepatitis C infected mothers acquire the virus. Hepatitis C can also be spread by having sex with an infected person or sharing personal items, a razor or toothbrush, with someone who has the virus, but these cases are rare. The signs and symptoms of hepatitis C: most people who contract hepatitis C do not have any symptoms, especially in the early stages. However, some people do develop early symptoms, which may include painful joints, fever, rash, swelling. But 3 out of 4 cases result in a chronic infection. In these people, symptoms may develop years, even decades later, when liver damage occurs. Others develop symptoms from 2 weeks to 6 months after infection. The average time to develop symptoms is 6 to 7 weeks after acquiring the virus. Those newly infected with hepatitis C may experience mild to severe fever, fatigue, abdominal pain, loss of appetite, nausea, vomiting, joint pain, dark urine, clay-colored stool, and yellowing of the skin, jaundice. A person who has hepatitis C infection but isn't exhibiting any symptoms can still pass the virus on to others. Acute vs chronic hepatitis C infection. Acute hepatitis C infection refers to symptoms that appear within 6 months of newly acquiring the virus. About 20% to 30% of those who acquire hepatitis C experience acute illness. After this, the body either clears the virus or goes on to develop chronic infection. Chronic hepatitis C infection refers to long-lasting infection. The majority of people who have acute hepatitis C infection, 75% to 85%, go on to develop the chronic form of the illness. Hepatitis C infection is diagnosed with several blood tests. The hepatitis C antibody test checks for antibodies, immune particles that fight the virus. A non-reactive result means that antibodies to the virus are not detected. A reactive result means antibodies to the virus are present. But the test is unable to indicate whether the infection is current or in the past. Another blood test assessing the presence of hepatitis C genetic material, HCV RNA test, is available. The results of this test can help doctors determine whether hepatitis C infection is current or not. Additional blood tests can be used to determine the amount of virus in the body, known as a titer. When someone has confirmed hepatitis C infection, the doctor will order more tests to assess the degree of liver damage. A liver biopsy may be performed. There are several different strains of hepatitis C virus that respond to different treatments. For this reason, the doctor will order a test to determine the genotype S of the hepatitis C infection. To help determine the course of treatment. Chronic hepatitis C infection is a long-lasting illness with potentially serious complications. Chronic hepatitis C infection is a long-lasting illness with potentially serious complications. About 75% to 85% of those with acute hepatitis C infection go on to develop chronic illness. Of those in the chronic illness group, more than 2/3 will develop liver disease. Up to 20% will develop cirrhosis, or scarring of the liver, within 20 to 30 years. Cirrhosis affects liver function and causes elevated blood liver enzymes. Up to 5% of people with chronic hepatitis C infection will die from liver cancer or cirrhosis. Chronic hepatitis C infection is the most common reason for liver transplantation in the U.S. Hepatitis C treatment has changed dramatically in the past 5 years. Hepatitis C treatment has changed dramatically in the past 5 years. Researchers now rely on antiviral medicines to target the virus and stop it from reproducing. These are taken in pill form, whereas older medicines were taken by IV, means intravenous. Hepatitis C and liver transplantation. Some people with advanced hepatitis C infection and severe liver damage undergo a liver transplant, but that doesn't eradicate the infection. Patients with active infection at the time of the transplant will develop hepatitis C in the new liver. Sometimes the infection recurs even when patients are on antiviral treatment. Those who have achieved sustained virologic response, SVR, means systemic vascular resistance, meaning no detectable virus in the blood 6 months after treatment, have a very low risk of developing hepatitis C infection in the new liver.